there is also the trigger point release.
Mm-hmm.
And that actually may be a necessary step before you can put maybe the third size dilator in, just because you may feel certain burning sensations or tightness sensations. Tell us about the trigger point release and what you could do, like what it is and what you could do about it.
Yeah, it's so interesting. So trigger points are, at the end of the day, to simplify it, just a knot like you get in your neck or in your shoulder. So if you've ever had a knot in your shoulder and you push on it, you feel a zinging sensation. Maybe you've got headaches and difficult to move the shoulder. Those happen in the pelvic floor muscles when we have tightness. And so that's one of the things that a pelvic PT will and can do on a person, on a male or female experiencing pelvic pain, is do some manual release. But it's also really nice to give some tools for people to be able to release them on their own too. The dilator, if it's a superficial trigger point close to the opening of the vaginal canal, the dilator may be able to reach it, and you could be able to hold pressure to do it. But I also created a trigger point wand specifically for that purpose of a person being able to manage these on their own. And the thing about trigger point release is, what I always tell my patients is, we're never, ever, ever going to hold pressure with anything, whether it's a dilator, a finger, a wand, more than you would use to check a tomato for ripeness.
Mm-hmm.
Right? So if you're at the supermarket and you're checking for ripe tomatoes, you would, give a little compression, but you would not pierce your tomato. And so the same thing goes, whether it's a finger or a dilator or the wand here, which I specifically designed to be able to reach the deep component. So it can reach superficial, but the curves here allow for it, so it goes into the vagina to be able to curve and hook into some of the deeper pelvic floor. But still, once we encounter one and you go, ouch, found it, you're going to move your leg. So if you're laying on your back and you're doing some trigger point release, when I'm working one-on-one with patients and we identify where the trigger points are, I tell them exactly where to move their leg. But just as a gross generalization, move your knee in or out until the pain goes away, because what you're doing is shortening the muscle. And when there's a trigger point and you shorten the muscle, it tends to shut it down and it's not as painful. So you hold pressure on the trigger point, move your leg. Once you feel that relief, you're going to stay in that position for 1 to 2 minutes, and then the trigger point will stop. It will shut down. So that is, there's so many different philosophies on it. And, if you Google trigger points, there's all these different kinds of academies and things on how to release a trigger point. And some people think, well, you just hold that pressure and it's going to be painful, but you got to take it. That doesn't have to be that way. And especially considering that we're not grinding on it. We're just going to hold gentle pressure.
Right. I really like that strategy about moving the leg. I actually I don't remember me doing that, but the gentleness is so important. Like, it really hurts, doesn't it? Like,
yeah,
from personal experience. So
I've been there. Yep. Trigger points were my thing. Yep. Which is part of what sparked this guy.